Imagine this: a patient walks into a clinic complaining of shortness of breath. Initial investigations come up clean, and the patient is sent home in a stable condition. But the very next day, the patient is back, the shortness of breath having returned and rapidly worsened. Then, without warning, the patient collapses. Immediately, cardiopulmonary resuscitation begins. After less than 10 minutes of intense effort, there's a sigh of relief as return of spontaneous circulation is achieved. Post-resuscitation, blood sugar levels, blood gases, and ECG are checked swiftly. But the real revelation comes from the echocardiogram. The left ventricular ejection fraction is normal, but there's right ventricular dilation. With the patient's recent history of dyspnea and the findings on the echo, suspicions of a pulmonary embolism begin to emerge. But the patient's unstable condition rules out a contrast-enhanced computed tomography pulmonary angiogram. So what do? You look for a potential source of the embolism. A point-of-care ultrasound is performed revealing a popliteal deep vein thrombosis. The pieces of the puzzle fall into place. The diagnosis: a massive pulmonary embolism secondary to deep vein thrombosis. A team of specialists, including a pulmonologist, cardiologist, and emergency medicine specialist, convene to decide on the best course of treatment. Given the patient's critical condition, the decision is made to administer thrombolytic therapy, tissue plasminogen activator, or TPA to be precise, to rapidly dissolve the clot and improve the patient's hemodynamics. The TPA is administered, and the patient is kept under continuous monitoring for their hemodynamic status, oxygenation, and response to the fibrinolytic therapy. Follow-up investigations and intensive care management continue, with anticoagulation therapy and supportive measures for recovery. This scenario presents a valuable lesson in the systematic approach to a critically ill patient with dyspnea and cardiac arrest. It underscores the importance of rapid assessment, collaboration among specialists, and timely intervention. It's a reminder that every second counts in such situations, and that the right decision can make all the difference between life and death.